You've finished your dissertation, you've completed your last clinical placement, and you're either counting down to graduation or you've had the ceremony. Now it's time to apply for your first speech and language therapy job. You find a Band 5 role which looks perfect on paper. You start the application form and quickly fill in your personal details and your degree. Then you hit the big empty white box, 1,500 words of supporting information. You're not sure how to get started, or maybe you hate the feeling of having to sell yourself. If that sounds familiar, then this video is for you. Hi, I'm Richard. I'm a speech and language therapist and a lecturer based in the UK. In this video, I'm going to talk about how managers read your job application when deciding whether to shortlist you or not, and I'm going to talk about how you can write the supporting information section of your application to give yourself the best chance of getting an interview. Fair warning, this is a long detailed video, so I've added timestamps in the description below so you can jump to the parts that are most relevant to you, but I'd still recommend watching from start to finish if you can. When an organisation or service advertises a job on the NHS jobs website, on Track or on their own website, the manager will have had to first write a personal specification listing the essential and desirable criteria that candidates must meet. This keeps the process fair and transparent and makes sure that the person who is hired is both qualified and they can do the job safely. These person specifications are usually aligned to generic job description templates for a particular band and service area, so managers don't have to create a new one every single time they advertise a job. This also helps ensure some parity, so a Band 5 speech and language therapist working in one location of a trust has roughly the same responsibilities as someone else working in another location. Essential criteria are the behaviours, skills and knowledge that you must demonstrate in order to be shortlisted. If you don't meet these or provide evidence of these in your application, you usually won't be invited for an interview. Desirable criteria, on the other hand, are additional things that are nice to have and might strengthen your application, but they are usually not expected, so these are seen as less of a priority. Managers often include desirable criteria to help differentiate between and rank applicants, which can be especially helpful with shortlist and Band 5 jobs, as applicants are often very similar to one another, having just graduated from university, and there may be a limited number of available slots to interview them in. Most new speech and language therapists in the UK end up applying for a job in the NHS, so I'll discuss how shortlisting works in this context, but the process is similar for most organisations. The manager or members of the shortlisting panel review each application anonymously to shortlist candidates for interview. They look through your application section by section on one side of their screen, and on the other there is a tick box with the relevant essential or desirable criteria listed. They read through the information you provide and tick a box if there is clear evidence you've met the criterion, or leave it unticked if there is no evidence or it's unclear. The ticks across all the essential and desirable criteria are then combined to give you a total score. Here's an example from the NHS jobs website itself for a nursing application. In some organisations, each criterion is rated on a numeric scale instead of a simple tick. So for example, a score of 1 might mean something like the applicant has clearly not met the essentials, whereas a score of 5 means the applicant has met all of the essential criteria and the desirable criteria. This allows a more granular assessment, but the underlying process is essentially the same. After all the applicants have been scored, the manager will then determine who to invite to interview. There is no mandated universal cut-off score for interviews across the UK because each organisation's person specification is essentially different. Instead, managers will set a local threshold to decide who is shortlistable. This will be something like meeting all of the essential criteria and scoring at least X overall. The manager will then look at how many interview slots they have available based upon staff availability and to start to invite in applicants. They will start with the applicants with the highest scores and then work downwards until the slots are filled. Some organisations also have disability confident guaranteed interview schemes where applicants who have disclosed their disability and meet the essential criteria will be offered an interview, so these need to be factored in as well. They might include some extra applicants as not everyone responds. Some applicants might withdraw their application or cancel interview at the last minute. If there is a large number of applicants, as there often are for Band 5 jobs, the cut-off score may be raised simply because they cannot interview everyone. This is also why adverts often tell applicants to apply straight away, as another common strategy is to close the vacancy early once enough applications have been received, so no more candidates can apply even if the original closing date hasn't passed yet. Now, the reason I've spent time explaining how managers and panels shortlist is because you need to understand how they read your application so you can tailor your supporting statement to try and score as highly as possible and get yourself the best chance of getting an interview. The guidance at the top of the supporting information box is actually very clear about what you need to do and what to avoid. It suggests that you should show that you've read the person specification, explain how you meet the essential criteria and relevant desirable criteria for the specific post itself, highlight what's unique about yourself and kind of what sets you apart from your peers, and avoid duplicating any information that's already elsewhere in the form or including any personal information. All of that sounds sensible, but it still leaves a big question. What does that actually look like in practice in a 1500 word statement? In the rest of this video, what I'm going to do is show you the approach that I use to write my own supporting statements step by step. It's a structure that I've used for my own Band 5, 6 and 7 applications for both private and NHS jobs, paediatric and adult, and when I've used it, it has consistently helped me to get shortlisted and invited to interview. Now, I can't promise it will guarantee you an interview, but it will make it much easier for a shortlisting panel to see how you meet their criteria. I went onto the NHS Jobs website and selected several Band 5 jobs at random covering a range of clinical areas, settings and geographical areas, just to demonstrate that this approach can be used by anyone. I'll also refer to my own experience and knowledge I had as a new graduate for context. The person specification documents attached to the advert might sometimes look a little bit different or use slightly different wording, but the structure is often identical across jobs, covering core domains such as education and qualifications, knowledge, experience, skills and abilities, or skills and personal qualities. And then there's often an other category or something like trust behaviours. The first domain that almost all jobs want you to discuss is education and qualifications. Here is the person specification for a post in a community learning disability team in the West Midlands, which includes 4 key requirements, 2 essential and 2 desirable. Now, because I know that the manager or shortlisting panel will have their person spec on one side of the screen and my supporting information on the other, I want to make their job as easy as possible. They might be reviewing lots of applications and are unlikely to have lots of time to look through each. I need them to say that I meet their person spec so they can tick the checkbox and give me a point for that element as quickly as possible. So the first thing I would do is simply copy and paste the person spec into a separate document. I would use their heading education qualifications to make it easy for them to find information. I would then look at the 2 essential requirements first and write these into statements to show that I meet the requirements. In this case, I would write I've got a degree in speech and language therapy and I'm registered with the HCPC. You don't want to repeat information from elsewhere in the application. You had to list your university and expected or final degree classification above. Likewise, you will have also had to say whether your professional registration was pending or you included your HCPC number above in the application. So keep it basic and don't waste any words here. Now I would move on to the 2 desirable requirements. If you're a member of the Royal College, just state this as a matter of fact. If you're not, then you can just omit this, but for this specific requirement, given that it costs students nothing to join the Royal College of Speech and Language Therapy, I would probably join before submitting my application just so I could include this and get an extra point. The final requirement is more involved and clearly relates to the client group itself. As I mentioned above, the desirable criteria are nice to have, so a manager would not reasonably expect you to be trained in all of these interventions unless you happen to work with people with learning disabilities before your degree. How you answer the questions will clearly relate to your own personal circumstances then, but you should always focus on things you can evidence first and frame any gaps positively. In my case, I'd done a Makaton course before I'd started my degree, so I would write something like this. I've completed relevant training in communication, strategies or techniques for people with learning disabilities. I've completed a Makaton for Professionals Foundation workshop covering stages 1 to 4. which is equivalent to level 1 and 2 now. I've also received teaching on intensive interaction, PECs and talk and mats at university and observed these approaches on placement, and I'm keen to undertake formal training in them whilst in post. Why this approach works well is because you're rewording the key requirements, you're demonstrating awareness that these are interventions to support communication, you're clearly anchoring the training you have completed first, acknowledging some knowledge of other interventions without overclaiming, but also showing a forward-looking attitude towards your own continued professional development. Other ways to strengthen this section would be to list other training not listed but relevant and mentioned if you're scheduled to complete any of these training in the future, say if you've signed up to complete an online training course in intensive interaction. If you hadn't done any training on these interventions or seen them on placement, you could simply use the first sentence about receiving teaching at university and then the last one about being keen to undertake formal training whilst in post. This is quite a weak statement that doesn't add too much, so I would only include it if you didn't need the word count elsewhere. The second domain that most jobs want you to discuss is knowledge, though this is sometimes grouped together with experience. Here is a person specification for a job in a community paediatric team on the South Coast, which includes 1 essential requirement, 2 desirable, and 2 fully competent, which I'll explain at the end. The first essential criteria is a bit of a red herring, given the essential criteria and experience below. So you need to be mindful to keep to the task at hand and be as economical as possible, otherwise you can make it harder for the manager or panel to give you a score here, or more likely, you will get a score and end up making another section of your application weaker. Now ideally you would provide lots of context to explain what assessments you're familiar with, how you came across them and link these to appropriate management strategies. But in reality, you probably don't have the word count for this, and the often binary nature of the scoring system might actually work in your favour here. The criteria is essentially probing the breadth of your knowledge, so it's important to mention assessments and therapies that are formal and informal, cover different domains such as language and speech, and cover different age groups as well. Given the breadth of possible answers here, there genuinely isn't one best way to approach it. I would play it safe and rewrite the criterion into a statement as before, so you have something like, I have knowledge of a range of assessments and therapy approaches for children with SLCN. I would then probably split my answer into preschool and primary school age children, and I would write something like, for younger children, I have knowledge of observation, play-based assessment and parental checklists for language, alongside early speech sound screeners and interaction-focused approaches such as Elklin and Hannon. For older children, I'm familiar with formal tools such as the CAL5 for language and the DEEP for speech, and therapy approaches including colourful semantics and shape coding for language, as well as complexity approaches, core vocabulary, and the Nuffield for more complex speech needs. Now this paragraph is very succinct and deliberately omits details such as which Elklin and Hannon program I'm referring to, and limits the number of speech assessments to the DEEP, because the point being made is about formal standardised assessments, so listing the clear or the STAP would only confuse matters and add extra words. What this paragraph does do is show the manager and the shortlisting panel a range of assessments and therapies that I can distinguish between younger and older children, and that I know that assessments and therapies for language and speech difficulties as well. Obviously, if I had more word count, then I could add extra examples in there. Moving on to the desirable criteria. There is evidence of continuing professional development criterion, which is very similar to the qualification example discussed previously. I would perhaps reword the criterion slightly into something like, I have evidence of completing CPD to develop my knowledge of working with children with SLCN. I would then list any specific interest groups, what are now known as Clinical Excellent Networks or SENS, I'm a member of, which relate to working with children. Some of these are free to join, whilst others have small annual membership fees. Given that it's essentially a free point when it comes to your overall score, I'd probably try and find and join a SEN before submitting the application. Now in my specific case, I was a member of a SEN, but not one that was relevant here, so I wouldn't mention it as it might look like I'm not interested in working with children. After this, I would then move to the short specialist courses and self-directed study. As in the qualifications section discussed previously, I would list appropriate qualifications and training that I've completed. Here in the fully competent section, they're giving you a hint that they value knowledge about sign and symbol systems, such as Makaton, so I would mention this if it applies. Given it mentions self-directed study, you have more scope to demonstrate understanding of different systems without having to necessarily have completed them themselves or any formal training. You could mention other systems that you've been taught about, read about, or seen on placement. So I would write something like, I've completed a Makaton for Professionals Foundation workshop covering stages 1 to 4, equivalent to levels 1 and 2. So again, I'm using the same wording from the previous section. And I put something like, I'm familiar with other sign and symbol systems such as British Sign Language, cued articulation or sign along for sign, and things like Blissy Symbolics, PECs, picture communication symbols, symbol sticks, and widget for symbol systems. Now, there is a tension between how much you want to demonstrate your knowledge and how many words you're using, so you can always reduce the number of examples given later on if you need to reduce the word count. Now, technically, I could have mentioned any paediatric interventions here, but why this works is that I'm explicitly tailoring my evidence of CPD specifically to the fully competent criteria that they've listed, so it looks like I'm ready to do the job. The second desirable criterion is more straightforward. I would rewrite the criterion into a statement like, I have knowledge and experience of clinical governance, and then basically unpack what this means to demonstrate some knowledge. This would look something like, during student placements, I've developed understanding of how to obtain and record consent, maintain confidentiality, and safeguard children. I developed knowledge of a range of different case note writing systems. I regularly use informal and formal outcome measures to monitor the effectiveness of therapy. I also engage in reflective practice and seek supervision to improve the quality of my practice. Clinical governance means different things to different services and different levels of therapist, so I'd be guided by whatever wording was included in their person specification and also the job description explicitly. So for example, some students get experience completing audits or service development projects, but others don't, and this is reflected in expectations with local employers. Now, if they did include something like experience doing audit later on in the person spec, I perhaps wouldn't mention that here. So again, it's just being judicious about where you're using your experiences and your knowledge. The third domain is experience, though in this particular application it is second in the list. Here's a person spec for a job in a community adult team covering planned care and early supported discharge in London, which includes 6 criteria, 3 of which are essential and 3 desirable. The first essential criteria may seem a little odd, as all UK students will have experience working within a variety of clinical settings in the UK and NHS as part of their degree. What the organisation is doing here is signalling that they want applicants who are familiar with UK clinical settings and the NHS, regardless of whether the applicant trained in the UK or has an international background. In this case, it might feel for most tick boxy, but we need to tick those boxes to receive the points. I would probably therefore write something brief like, I have experience completing 6 student placements in a variety of clinical settings within the UK and NHS, including an in-campus or on-campus aphasia clinic, an on-campus literacy clinic, a stroke ward, inpatient mental health, and 2 community paediatric teams. If you've got experience working and volunteering, you could potentially mention that as well, but I wouldn't personally use that for the word count on this specific criterion. Now, the reason I bothered to list some of those specific placements which aren't relevant to this particular job is because it links directly to the next essential criteria and some of the desirable criteria. So again, I'm setting myself up to use my word count as efficiently as possible. For the second essential criterion, it is prompting me to talk about multidisciplinary work on clinical placements. Now, you might have lots of examples to discuss here, but you need to be mindful of the word count itself and also the job at hand. In this case, I would prioritise discussion around the stroke ward first, as it aligns most closely with the clinical group of the job itself. And I might write something like, I've got experience working and liaising with other multidisciplinary professions in a range of settings. On my stroke placement, I completed several joint assessment and therapy sessions with a physiotherapist and occupational therapist. I shadowed a dietitian and a nurse to develop my understanding of their roles and how they work collaboratively with SLTs. On a mental health placement, I also worked alongside psychiatrists, psychologists, music therapists, and social workers. Now, for this criterion, it would be very easy to get bogged down in giving lots of detail about the type of assessment and therapy sessions themselves, or start to list every single MDT profession you've ever come across. Here, I selected stroke as the most important one, as I wanted to discuss it because it was the most relevant to the job, but I did also include the mental health one just to show a wider range of professions that I've come across. I actually also work with nurses and occupational therapists, etc., on this placement as well, but again, the repetition doesn't really add anything to the section, so I omitted that fact. The shortlisting panel just want to see some evidence that you've worked with other professionals, and there is just diminishing returns when you start to just keep adding more and more. You can also get into more detail about specific sessions in an interview if the relevant question comes up. The last essential criterion is the most complex of the three. I would reword the criterion into a statement, as before, and keep the specific wording. I would then discuss a concrete example from the stroke placement, as it is the most relevant clinically to the job. I would then use a formal structure like CAR, which stands for context, action, and result, to structure my example. So I would end up with something like, I can communicate with patients in an empathetic manner regarding their assessment and treatment. During my stroke placement, I completed a dysphagia assessment on a patient who was nail by mouth. They had been told by nursing staff that the speech therapist would come assess them and he would be allowed to eat and drink then. I invited the patient to share what they'd been told so far. They were also aphasic, so I used clear, non-technical language to explain the outcome from the assessment, which was that he was to remain nil by mouth, unfortunately, as his swallow was unsafe, and paused and checked his understanding regularly. I could see that he was visibly upset about what the nurse and staff had promised him, and obviously the outcome of the swallowing assessment itself. I gave him space to express his emotions and ask questions. My supervisor's feedback highlighted my effective use of active listening, how I validated his emotional response, and successfully redirected him with a clear plan to start therapy and review his nil by mouth status on a daily basis. Now, this is quite a lengthy example, and you can't give examples like this for everything, so you need to consider whether this is the best criterion to use a lengthy example for, or whether you could express it more succinctly. I would leave any editing until the final supporting information was fully written and you knew how many words you were over. Now, if you didn't have any relevant clinical adult examples to discuss, then you could give a brief example from another clinical group, but I would be brief and quickly move on. Now, the next three desirable criteria can be written quite briefly given the lengthy paragraph before this, and also the information in the original first paragraph, just to vary your writing as well. I would write something like, I have experience working in 2 community SLT services, and combine this directly with the next to say something like, this included experience working with SLTA assistants in several mainstream schools. And again, this demonstrates transferable skills between the different caseloads. The final criteria is a little bit differently and probably deserves a sentence itself. So I would write something like, I've completed an audit/service development project where I interviewed clients with autism, learning disabilities and mental health difficulties on several inpatient mental health wards about their own involvement in their own care planning. I created accessible versions of their care plans to see whether this would make them more accessible. I had to analyse data, write a report, which was then presented to the service. Now, this example is a little bit longer, but again, it's quite descriptive in terms of the different elements of this project itself, many of which would be transferable to an adult service, such as the data analysis, such as the making accessible resources, and obviously having clients or service users with lots of care plans in place. Now, some of those examples might have felt too brief or too concise, but actually it ended up being 378 words, which is approximately 25% of the total support and information statement. So again, the experience section is really quite important, but you can always add things to it if you do have the word count, but you need to make sure that you're kind of hitting the main points, and you can always elaborate upon your examples in the interview itself. Again, it's just collecting enough evidence to tick those boxes for the essential criteria generally. The final main domain on most Band 5 applications is skills and abilities. This section usually contains the greatest number of criteria in the person specification itself, so this is where you should spend most of your word count and provide more worked examples. The criteria are often spread across multiple domains such as communication, clinical reasoning, caseload management, multidisciplinary working, which can often mean that the individual paragraphs are often fairly self-contained rather than overlapping with one another, which can make it difficult to manage your word count. Here is the person specification for a developmental Band 5 to Band 6 job in an adult inpatient forensic mental health hospital in the Northwest, which includes 8 criteria, 5 essential and 3 desirable. As mentioned previously, the kinds of examples you can draw upon will obviously relate to your own personal circumstances and which clinical placements you completed on your degree. Some applicants will get direct clinical experiences or placements in specialist settings related to applications like this, and some won't. If you don't have direct experience, then it is about closely reading the information provided in the job description and person specification, identifying transferable skills from the experiences you do have, and then selling them as hard as you can. The first essential criterion asks you to demonstrate excellent interpersonal skills, including observation and listening. I would begin by restating the criterion into a statement, so something like, I have excellent interpersonal skills, including observation and listening. I would then use the CAR structure I mentioned earlier, context, action and result, to flesh out a clinical example to demonstrate the criterion. Even if you had not completed a placement in this setting before, the rest of the personal specification gives the applicant strong clues about what they could put or how best to tailor their application. There is mention of the service wanting the applicant to have an awareness of communication profiles associated with mental health, forensic populations, brain injury and or neurodivergent presentations. There is also mention of wanting someone who has experience of working with people with complex and multiple needs, e.g. dementia, dysphagia, mental health. So in this case, it means observing the particular communication characteristics of these populations and listening to them. So in my case, I had actually completed a placement in an inpatient children and adolescent mental health service, also known as CAMS in the UK, so highly relevant to this role. I would give context to something like, during my inpatient CAMS placement, I work with a service user with autism, a learning disability and several mental health conditions which contributed to significant communication difficulties. The action part of the example would then be something like me demonstrating the observation and listening skills directly. I would put something like, he rarely communicated with others, so I took time to observe his non-verbal communication and how he interacted with different members of staff. In a one-to-one session, I used talking mats to reduce expressive language demands and applied active listening skills to understand his priorities, reflecting back what he said and acknowledging his feelings to help build trust. In the results section of the example, I might put something like, as a result, and then clearly state the change in behaviour which I saw as a consequence of my own actions. So something like, he became more willing to engage in assessment tasks, which allowed me to build a profile of his strengths and needs. This helped him set his own goals and enabled me to support the wider multidisciplinary team to work with him more effectively. If you didn't have direct experience working in mental health, then because of the clues provided in the document, as I said before, you should still be able to identify examples where you've observed and listened to someone with a brain injury or someone with dementia or someone who is neurodiverse that are still relevant to this criterion and can earn you a score from the manager or shortlisting panel. The next couple of criteria are more generic skills, but you can make sure you score a point by giving the right kinds of examples. The second essential criterion asks if you have well-developed presentation skills, both written and verbal. I would reword this rather to something like, I've well-developed written and verbal presentation skills. And after this, because this criterion is asking about different kinds of skills, a CAR approach wouldn't be as effective, particularly with the word count. Instead, it would be better just to briefly identify situations where you've perhaps used written and verbal presentation skills in clinical practice. So for example, I might write something like, On clinical placements, I've written a range of assessment and discharge reports and made referrals to community services. I've presented verbally in morning handovers on an acute stroke ward and in an inpatient psychiatric setting. I've fed back formally about SLT progress in monthly MDT meetings and more formal meetings with external commissioners and the MDT, e.g., CPA, CTR reviews. I've also participated in training staff in schools about communication strategies. So why this particular approach works, so even though I'm just listing particular generic examples of, say, report writing or attending meetings, some of the examples given relate specifically to mental health settings. So for instance, reading and writing particular discharge reports, which can be quite lengthy in psychiatric settings. Likewise, the CPA and CTR meetings that I referred to, they're very specific to psychiatric settings, both inpatient and outpatient. So by being able to reference those specifically, again, it's showing my awareness and my knowledge of what it might be like to work in a setting like this. The third essential criterion asks us whether we've got good IT literacy. I would reword this as I've either got good IT literacy or I've got excellent IT literacy. Then give a couple of examples to demonstrate knowledge of how this applies in clinical practice. Again, the document itself gives you some clues about what it means by IT literacy. I would start with clinical systems, then move on to the more generic software. I wouldn't provide too much context as it's not the best use of word count, so I would write something like, I've experienced using electronic clinical record systems to document sessions and outcomes, e.g. Care Notes, Rio, System 1. I'm proficient with standard Office programs used to write emails and reports and create training presentations and input and analyze data, e.g. Outlook, Word, PowerPoint, Excel. The fourth essential criterion asks us whether we've got excellent time management skills. There's a word missing here which I assume was organisation, but the document itself gives a very explicit description of what this means in terms of the job description itself. It mentions managing a caseload, including complex cases, as an autonomous practitioner prioritising and managing the caseload independently based on the principles of risk and clinical risk. You also need to complete timely returns on an individual level relating to activity and performance. Finally, you need to attend to all relevant meetings, case reviews, case conferences related to patient care. Now, it's important to recognise that this language used in the job description reflects the developmental nature of the Band 5/6 post. A newly qualified therapist isn't expected to walk in on day one and independently manage a full complex caseload, or all the associated admin that goes along with it. You'll be supported and supervised whilst you grow into that level of autonomy, so it is important not to overclaim your own level of autonomy right now. As before, I would rewrite the criterion into I've got excellent organisational and time management skills. I would then use the CAR structure again to give a clinical example. The context here would be something like, on my last community paediatric placement, I was responsible for a small supervised caseload of children across several schools in the county. The action would be something like, I planned a weekly timetable that prioritised children with higher clinical risk, e.g. more severe communication difficulties, educational disengagement. I scheduled these sessions around agreed review dates and meetings. I factored in travel time between sites, included documentation, and follow-up with other members of the multidisciplinary team. I checked my plan with my educator where appropriate. The result of my action would be something like, as a result, I consistently met agreed timescales for sessions and documentation. My educator reported that I was managing my workload effectively and allocated me more children to my caseload. The fifth and final essential criterion asks you to demonstrate resilience. The document again is very explicit about what this means in practice. It mentions an ability to work with clients with social and/or mental health difficulties who may present with unpredictable or challenging behaviour. You also need the ability to work flexibly in response to service demands. There is mention of communicating highly sensitive and distressing information and forming empathetic relationships with people who may be under stress, and therefore there might be barriers to understanding as well. In this context, then, resilience means dealing with the behavioural and emotional complexity of the patients without becoming overwhelmed. It also means staying professional and effective in how you work when the work itself is routinely unpredictable and emotionally intense. I would start by rewriting the criterion into a statement, something like I can demonstrate resilience when working with clients with social and or mental health difficulties. I would then use the CAR structure to give a clinical example. For the context, I would say something like, during my CAMS inpatient placement, I was involved in sessions with a young person who started talking about self-harm, which was emotionally challenging for me. Now, whilst this example obviously relates explicitly to the job, you can achieve the effect by focusing on challenging or unpredictable clinical situations in general. Again, the manager and shortlisting panel will recognise that not all applicants will have had the same opportunity to do a placement in mental health. For the action part, I would then explain how I managed my own emotions, sought support, adapted my plan, or sought supervision afterwards in response to the context. So I might say something like, I tried to redirect the conversation back to the task at hand, but upon reflection, I wasn't sure whether I'd done the right thing or made things worse by dismissing what the patient was trying to talk about. I met my supervisor afterwards to discuss this. They initially reassured me, then arranged for me to attend some training delivered by the clinical psychology team on understanding and responding to risky behaviours. For the result, again, you would explain how you learned or adjusted your approach so that care remains safe and effective. So I would say something like, as a result, I've been able to remain calm when similar situations have come up again because I have a better understanding of self harm and the functions of the behaviour. I'm able to reflect upon my own feelings in the moment and ensure that it does not interfere with my interactions so I can better support the young people without becoming overwhelmed. I'm also aware of opportunities for MDT peer supervision to seek support around these issues if they become challenging. Why this example works well is because it explicitly links resilience to the challenging behaviour and unpredictability of working in a mental health setting. It's just part of the role and it's not going to go away. It also clearly frames seeking supervision and training as strategies to support resilience. You're not expected to become resilient overnight or know how to deal with challenging situations on your own, especially as a band 5/6. The idea is that you become less emotionally overwhelmed and more clinically effective over time, not to be untouched by your own or someone else's distress. Now, the next three desirable criteria are more challenging than the previous domains. The first is fairly straightforward, whereas the second and third could almost be essential criteria in themselves. For the first criterion, I would reword this to, I've got skills in using digital platforms to deliver assessment and intervention. Now, when I was a student, telehealth wasn't a thing, but it is more common now, so you may have had an opportunity to use it on placement. As with other sections, you start with any positive experiences you do have, then frame any gaps as a positive to show knowledge without the direct experience. So I might write something like, I've regularly used software to create resources for therapy sessions, e.g., Boardmaker widget. Have used digital talking mats on a tablet to set goals, and apps on a phone in therapy sessions, e.g., Voice Analyst. I'm aware digital platforms such as Q Global can be used to conduct assessments online, and the NHS uses both standard and specially commissioned digital therapy platforms to deliver services, e.g., Microsoft Teams and Silver Cloud. Here you can see a clear shift from where I'm talking about my own specific experiences, then broadening out to areas I'm aware of but have no direct experience with. This is still valid, but if you were struggling with the word count, then I might just omit the second part and just include the first part, which is structured to include examples relating to preparation, assessment, and therapy anyway. The second desirable criteria asks you to demonstrate well-developed analytical, reflective, and negotiation skills. Criteria with multiple behaviours are hard to answer well, and you're unlikely to find a single clinical example which convincingly covers all three. A full car response probably isn't the best use of word count, especially as this is desirable rather than essential. So the aim is just to show each behaviour briefly and specifically linked to the job description. One way to tackle this is to reword the criterion as you have done for the others to something like, I've well developed analytical, reflective and negotiation skills. You can then address each behaviour with a succinct point linked specifically to behaviours mentioned in the job description. This will sound quite generic, so you need to bring in an example relevant to the service if you can to try and counter this. You also need to keep the points succinct to avoid it feeling like reading a list. So for analytical skills, I would write something like, I use analytical skills during assessment, taking different factors into consideration to formulate a differential diagnosis and appropriate management plan, e.g., history of trauma, language difficulties, limited engagement with mainstream education, effective mental health condition. Now, the job description mentions undertaking comprehensive assessment, formulating a hypothesis, etc. So I'm just reusing the wording here. It is very generic, so the example here is doing a lot of heavy lifting. I'm briefly demonstrating an awareness of some of the clinical factors which would be relevant to a patient in a mental health service when I'm assessing them. Now, because you're discussing 3 different skills here, it's helpful to restate the specific skill to help signpost your reader so they know you've addressed it. This might feel like a waste of words, but it is easy for the reader to miss a point or get lost in a dense paragraph like this, especially towards the end of your supporting information. So for reflective skills, since you've already given an example in the resilience criterion around self-harm, I would keep this as short as possible. I would write something like, I regularly engage in reflective practice on clinical placement, both verbally and in writing, using formal models to help structure my feelings and thoughts, e.g. Born. You've already provided evidence that you've reflected in another criterion, so this is just to demonstrate that you can reflect in different formats and understand the benefits, perhaps of using a formal structured model. For the last negotiation skill section, this is really just asking you to demonstrate collaborative goal setting and agreeing management plans as an example of negotiation skills. Building on the earlier talking mats example, I would focus on a generic statement that still shows you understand what they want. So I would write something like, I negotiate therapy goals collaboratively with patients to ensure buy-in and optimize outcomes, using tools such as a talking mats to explore someone's level of insight into their strengths and needs and agree priorities. The only thing I've done with this example is use more formal language to describe my approach to goal setting and introduce the idea that I can explore someone's level of insight into their strengths and needs during this process. The final desirable criterion asks you to demonstrate problem solving and decision making in relation to clinical practice. This behaviour overlaps heavily with the previous criterion, and this is one of the frustrating parts of writing job applications. It can feel as though the employer is asking you to evidence too many overlapping behaviours without giving you sufficient word count. I would step back here and perhaps think about why there might be different criteria. The first criterion on being analytical, reflective, and good at negotiation is more about the specific cognitive and interpersonal behaviours that you have, whereas here the criteria around problem solving or decision making is more about the whole process. I would reword the criterion as I can effectively problem solve and make decisions in clinical practice. The next step would be to provide an example where you've spotted a problem in clinical practice and decided what to do next. This can technically be about anything, but the manager and shortlisting panel will appreciate an example which relates to clinical issues you're likely to encounter in their service. If you've got the word count, this criterion would definitely benefit from a car response. So for the context here, I might write something like, on one inpatient placement, I observed that staff were not consistently communicating effectively with several patients, especially given the high number of agency and bank staff working on the ward. For the action, I might write something like, I spoke to several staff and identified that the existing communication passports were hard to locate and too dense and difficult to understand for staff to read, especially new staff at the beginning of a shift. I adapted their layout and format to make key information more prominent and spoke to the ward manager about including them in the observation sheet that staff fill out when they're on a patient's observations. For the result, I might write something like, as a result, staff report the information was easier to find and understand. I then observed more consistent use of the recommended communication strategies with those patients. This is a problem that almost every single speech and language therapist will face across multiple settings, regardless of whether they work with children or adults, so it's easy for panels to understand. The detail in the context sentence about inpatient placement could actually apply to many placements, whether it's an acute adult placement or mental health placement. What makes it relevant in a mental health role specifically is the mention of agency and bank staff, which are used a lot in those settings. Small details like this demonstrate good awareness of the likely challenges you'll face in post. This job description also mentions working across different wards, so there will likely be variation in how each ward is staffed and how consistently they follow SLT recommendations, which makes this a very believable example. In the previous section, we covered the four main domains likely to be in the person specification: education and qualifications, knowledge, experience, and skills and abilities. These make up most, if not all, of the supporting information. I thought it would be useful now to give some tips about how you might approach the actual writing and revision of your own supporting information for your own application. You can break this process down into clear steps so you can plan and write your supporting information as efficiently as possible. The first step is to read and familiarise yourself with what you're being asked to write about. You might find it helpful to print out the person spec or the job description, or copy and paste the person spec into an empty document like I did. I personally find it useful to have a table in a document where the criteria is in the left column and an empty box is in the right column, so I can put some initial drafts or an initial draft answer to that particular criterion. Now, you might understand what each criterion is looking for after this initial read through, but as I've discussed in several of the sections, if you're unsure, the person spec and the job description itself will often explicitly tell you what you'll be doing in the job itself. So if you're unsure, it is definitely beneficial to read the whole document. The second step is to look objectively at the person specification now and reflect honestly whether you feel you meet every essential criterion or can give a plausible trainee level example that addresses it. This is not to put you off from applying for jobs, but you do need to do a sanity check, because every application, if you're doing it properly, is a significant investment of your time. If you're ever unsure, I would always encourage you to reach out to the person named on the advert and just ask them directly. Say you see an advert which lists experience working in an acute environment with adults with acquired communication difficulties, but you've done a placement where you've got experience working with this population but in a community setting. You can ring them or you can email them, and you can directly ask whether you'd be considered with your current experience or not. You might get a reassuring approval from the manager that your experience is relevant and they encourage you to apply. You might get a curt confirmation that they are ideally looking for someone with acute experience. They may or may not give you a rationale why, but the service usually has a legitimate reason. They won't necessarily tell you not to apply, but if you're not getting overt reassurance and encouragement to apply, you need to accept there is a good chance that your application might not be successful. If this is the case, then they potentially are saving you hours of time writing an application, which has not got a great chance of being shortlisted for an interview anyway. If you feel they're willing to have a conversation around this, you could perhaps suggest that you've asked for an acute placement whilst you're a student, but you were allocated to a community placement instead. Again, this demonstrates an interest in the job itself. If you're feeling brave, you could potentially ask them about the best way to bridge this lack of direct experience, and they might suggest or offer things like shadowing a member of their staff to get direct experience of the acute environment, or you could directly pose this to them and ask for it. The third step is to decide how best to approach the writing. Do an initial triage of the criteria into what you think can be evidenced and written quickly, such as HCPC registration, IT literacy, etc., and what likely needs more thought, and some of those car examples we discussed earlier. Now you need to think about the best order to write your supporting information in. Writing it in chronological order is definitely not the best writing order. You can realistically approach the writing order in two ways. You might start with the low effort factual criterion you identified before, or alternatively, you could start with the harder sections likely to contain or need more car examples, such as skills and abilities. If you do start with these, it does give you more time to draft and refine your answers, and means you're more likely to use your best examples in these sections where they are necessary or are likely to have the biggest payoff. The fourth step is to physically start drafting your answers. Start with the essential criteria and each domain and rewrite each criterion into an assertive, positive statement like I showed earlier. By this point, you should know whether each criterion just needs an assertive statement and evidence or a lengthier car example. For the assertive statements, always start with positive examples of things that you can actually demonstrate or have evidence of. Remember the example I gave earlier in the education and qualifications section, where I started with the Makaton course I had completed, then positively stated my ambition to complete further training on courses for communication interventions that I hadn't completed yet, ones that I just had some knowledge about. For the lengthier examples, use CAR to help structure your answer and ensure sufficient depth. The fifth step is to edit the essential criteria once you've got a draft for all of them. Don't edit your answers whilst you're still writing them. This will slow you down and you will waste time, as you'll come back to it again and again and edit them anyway. Focus on content initially. Check to make sure that the criterion is actually covered as intended. Ask yourself, where in this sentence or paragraph have I shown the relevant skill, knowledge, or behaviour that's been asked? If it's not clear, then mark it for a rewrite. If you're happy with the content, then move on to the wording itself and whether you can trim any words that do not add anything unique or repetitive or unclear. What I'm talking about here is a sentence like, I feel like I'm able to, which is 6 or 7 words depending on whether you use a contraction, when you can actually shorten it to something like, I can. Again, it's much punchier and gets to the point. One thing you do need to think about though is finding a balance between wording that might be on the face of it appear redundant, but is actually signposting your reader around your supporting information or helping to link your points together. I suggested before using the wording of the criterion itself as the starting point of each answer and rewriting it into a positive statement. But there are other words and phrases which may appear in larger paragraphs, such as on my CAMS placement, for example, as a result. These phrases might look like extra words, but they make your supporting information much easier to navigate and draw the reader's eye to the fact you're answering each criterion with concrete evidence. Once you get to the end of this process, go back to the content you mark for a rewrite and do the same process again. If you can leave your supporting statement for a day or two and come back to it with fresh eyes, you'll be surprised how many new errors you pick up or how many more concise ways you can word something. The sixth step is to start drafting your answers for the desirable criterion. At this point, you'll know approximately how much of the word count you've got left. The final step is to edit the desirable criteria and read the whole supporting information to make sure it's both under the 1500 word limit and also make sure it's coherent as a whole piece. Sometimes it's easy to remove words, so for example in the knowledge section, if you listed 3 assessments, can you get away with only listing 2 to save yourself a word? But when it comes to the desirable criteria, especially those with car examples, sometimes you need to make a hard decision about whether it's better to include one desirable criterion with a strong car example that does use more word count, or do you include 2 criteria but the examples aren't as good because you haven't got enough words to do both justice. In this case, you're using your word count, but you might not be using it to provide clear evidence that actually earns you a tick from the manager and shortlisting panel. In terms of coherence, are you keeping the headings for the domains, and are you ordering the points in the support information so they mirror the order of the criteria listed in the essential and desirable criteria itself? Do the earlier points in the statement provide the context for later evidence so you don't have to repeat yourself over and over again? One final point. The word limit for support information is 1500 words, but given what I've said about how it's reviewed and how the reader might be reading lots of similar applications in a row, I would advise you to write shorter supporting information if possible. The goal is not to fill 1500 words. It is to cover the essential and key desirable criteria in as few words as possible while still being clear. The candidates who are likely to stand out are the ones who can provide clear, unambiguous evidence as concisely as possible. I also encouraged you before to apply early, and if you're writing shorter statements, this one might often allow you to apply earlier as well. This has been a long video, so well done if you've made it this far. I thought I'd summarise some key take-home points here at the end. You need to understand that the person specification includes essential criteria, which are things that you must demonstrate in order to get shortlisted, and desirable criteria, which are nice to have but not strictly necessary, and they shouldn't put you off applying. The manager or shortlisting panel read and score your supporting information against each criterion, often in a tick box fashion, whether you provide clear evidence or not. Managers will decide a threshold score to determine who is appointable to the post and invite applicants with the highest scores first and work down their list based on the number of interview slots they have. Before writing your application, do a sanity check. Can you genuinely meet every essential criteria? Would it be useful to speak to the manager to check? Set up a working document or table with the criteria and space for notes and draft answers. Triage by separating quick factual criteria from those which are likely to need longer, structured clinical examples, and decide whether you'll write the easy bits or the hard example sections first. Write draft answers for all of the essential criteria first, turning each criterion into a positive assertive statement backed by specific evidence. Edit in 2 passes. First, check content and whether you've clearly shown the knowledge, skill or behaviours, then tighten the wording while keeping helpful signposting phrases. Write and refine desirable criteria with your remaining word count, prioritising a few strong examples over many weak generic ones. Aim for a clear, concise statement under 1,500 words that covers every essential and key desirable criterion without wasting the reader's time. So that's an overview of how managers review job applications and some advice about how you can write your supporting information to increase your chance of getting an interview. If you found this video useful, make sure you like it and subscribe to the channel. Maybe go watch my video where I talked about how I became a speech and language therapist and a lecturer. I used the same approach for all of these jobs with good success. Otherwise, thanks for watching and take care.